Good evening and thank you for joining us. We begin tonight with the pandemic. It's been a week of record-breaking numbers in many parts of this country, and the models show the cases of COVID-19 may only get worse. BC hit another record with 617 new infections. And today, Ontario announced it is lowering the thresholds for imposing tougher measures. The change means more regions will move into red alert mode. This is the most restrictive level, short of a lockdown. And today, Premier Doug Ford warned he won't hesitate to move the province in that direction again.
I will lock down quicker than you can blink your eyes, because my number one priority is to protect lives, protect the safety of every single person in Ontario.
Eric Sorensen reports on how Ontario is changing course to curb the rapid reach of the virus.
Not only is the pandemic hitting harder than in the spring, Canadians and government leaders have been more resistant to locking down this time. But with disturbing new forecasts of rising cases and hospitalizations comes a new tone from one Premier, Doug Ford.
Families should not, I repeat, not visit any other households or allow visitors to their homes. And please avoid social gatherings.
And there will be an impact on more restaurants and other businesses across the province. Ontario has changed the threshold for restrictions from 4 regions under intermediate and stringent measures to more than a dozen now deemed in the orange and red zones.
We're staring down the barrel of another lockdown. And I will not hesitate for a second if we have to go further.
From a low of fewer than 100 cases per day in August, a sharp rise this month to an average of more than 1,350 confirmed cases per day over the last week. Ontario's modelling consensus says that could rise to 6,500 per day by mid-December if left unchecked. A circuit breaker, a hard, brief lockdown to break the chains of transmission, could reduce the spread noticeably. But how far down the numbers go would depend on many factors: how severe the restrictions, how long they would last. The measures have to do more than bring case numbers down temporarily, say experts, or else they'll just go up again when the restrictions are lifted.
If something like circuit break or general lockdown is to be used, we've got to be crystal clear as to what the goals are. And if the goal is to secure testing, contact tracing, then we need to meet that goal.
A long, hard winter was always expected, but Canadians are tired of the pandemic, and their tolerance will be tested.
Which is better? Which is more tolerable? A series of lockdowns or one hard lockdown? Any strategy from the government down needs buy-in from the public. And so ultimately, this is always in the hands of the public. How much are we willing to restrict our average numbers of contacts?
In Ontario, the hope is to avoid a total lockdown, to keep schools open, give most businesses some flexibility, and see how things go as Christmas approaches. Eric Sorensen, Global News, Toronto.
The prairie provinces are struggling to deal with rising COVID-19 cases. Manitoba and Alberta have already brought in tougher restrictions, and today Saskatchewan followed suit. But as Roberta Bell reports, not everyone feels the new rules go far enough.
I'm not going to sugarcoat the situation. It's not great, and it's been getting worse.
A bleak warning from Saskatchewan's health minister. With more than 1,400 active cases in the province, 81 of them new Friday. At the rate things are going, officials say the healthcare system will not be able to keep up.
What we feared what could happen is starting to happen, and we have a very unique opportunity right now to be able to flatten that curve again.
The minister says a slowdown is necessary to avoid a lockdown, announcing new measures under a public health order. Expanding the mask mandate from the 3 biggest cities to all communities with populations over 5,000, limiting alcohol sales at restaurants and bars. Last call will be at 10 o'clock and people will have to finish their drinks by 11, and capping group fitness classes at 8 people.
We are watching what's happening in Alberta. We are watching what's happening in Manitoba. We are watching what's happening just south of the border to us. And it feels like COVID is crushing in from all sides.
After hearing the restrictions, a group of doctors who wrote a letter this week asking the province to clamp down say, unfortunately, the additional interventions announced today do not go far enough.
I'm terrified. And I think that is the word that I would use. I lose sleep at night. I worry about my children. I worry about my parents. I worry about my colleagues. We've seen this virus cripple healthcare systems across the world.
The business community is pleased there's no shutdown, but the president of Regina's Chamber of Commerce wants people to follow the rules. Saskatchewan's chief medical health officer says if we can't limit transmission, then we could see more restrictions coming in. These ones, though, will begin Monday and be in place until at least December 4th. Robin?
Roberta Bell in Regina. Thanks, Roberta. There are tighter measures in parts of Canada's north. Today, Nunavut confirmed its 4th case in a week. Prior to November 6th, it hadn't recorded a single infection. The territory is putting more restrictions on gatherings and non-essential travel in Iqaluit and the region of Kavalik. Prime Minister Justin Trudeau has told the country's premiers they can count on Ottawa's help through the next phase of the pandemic. But the pledge comes with a caveat. As David Akin is here to tell us, that involves taking aggressive steps to stem the spread. David?
Well, Robin, on Tuesday, Prime Minister Justin Trudeau challenged premiers to do more to meet the looming health crisis. And they responded. One premier after another this week announced new lockdowns and new restrictions. Now they need more federal help. Manitoba asked for and will get federal help to run some of its long-term care facilities.
The Canadian Red Cross is already on the ground assessing the situation and is working with local and provincial authorities to determine their specific needs.
Quebec, too, asked for and will get an extension on a federal program that helps that province with its long-term care facilities. But will the plans put in place by each premier be enough? Trudeau said it was not up to him to judge.
Those are questions that quite appropriately are to be asked by citizens in the provinces.
Meanwhile, more grim numbers. Now, more than 10,700 deaths in Canada from COVID-19 and an average daily new case count that is at 4,300 and curving upwards.
If we continue on the current pace, it is estimated that there will be over 10,000 cases daily by early December.
And without flattening that curve, the chance of a normal Christmas will disappear.
Right now, it's not looking good.
But the lockdowns needed to flatten that curve will inevitably cause economic harm. So, to ease that pain, Trudeau announced an additional $1.5 billion for skills training to help those who will need to find new jobs.
But we have to do our part to flatten the curve before it gets any worse.
And Ottawa will be asked to spend even more. Prime Minister Justin Trudeau and the premiers will meet in early December, where the provinces will press for permanent and significant increases in federal health transfers. Robin?
David Akin in Ottawa. Thanks, David.